Welcome to Audio Guide 3, a patient's guide to understanding complex perianal fistula. This guide is produced by the Global Healthy Living Foundation and made possible with support from Takeda. I'm Corey Greenblatt, Associate Director of Policy and Advocacy for the Global Healthy Living Foundation. And today, we'll learn more about the symptoms of fistula and how to talk to your doctor about them. Whether you or someone you know has a fistula, or even if you think you might, these audio guides are designed to help make sense of the symptoms and get you the care you need. Accurate information will help you work with your healthcare team to hopefully have fewer and less severe symptoms. Please remember that fistula is a medical issue, and always talk to your healthcare team if you have symptoms that bother or worry you. A fistula is one of the major intestinal complications of Crohn's disease, affecting roughly 35 to 53% of people with Crohn's. In general, a fistula is an abnormal tunnel between two areas of the body. A fistula diagnosis can initially feel overwhelming. You might experience symptoms that seem embarrassing or uncomfortable, such as stool or gas leakage, which can impact your body image and self-esteem. It's understandable if you're hesitant to discuss these symptoms with others. However, it's important to remember that reaching out to your healthcare provider and sharing what's going on is a crucial step. It's your healthcare provider's job to listen, no matter how uncomfortable it feels to talk about your symptoms. By openly discussing your symptoms with your healthcare professional, you can begin a treatment plan right away. Left untreated, the condition can get much worse. The two main symptoms of perianal fistula are pain and drainage. The location and severity of the fistula will determine your symptoms. Fistulas can initially cause a lump or swelling around the anus that can be very painful. You may feel pain or irritation when sitting, moving, coughing, or having a bowel movement. The growth of perianal fistula can also cause the drainage of pus, blood, stool, or mucus. Additionally, you can experience symptoms such as fever, chills, redness, bleeding, constipation, uncontrolled bowels. Talking to your doctor about the unpleasant symptoms of perianal fistula can be very hard. It can feel awkward or embarrassing, but know that fistula is not your fault, and your doctor is there to help and see what they can do to minimize the impact on your quality of life. If you think you are having fistula symptoms, you should see a gastroenterologist or colorectal surgeon. Going to a center that specifically works with patients with inflammatory bowel disease, or IBD, can make the conversation easier since the healthcare professionals are practiced in talking about IBD and the complications such as fistulas. Once you have an appointment, here are a few ways you can participate in the conversation. Number 1, bring your medical history of Crohn's disease or other inflammatory bowel diseases if you have one. Number 2, note the location and severity of your pain. Is there pain or tenderness around the rectum? Do you feel a tender lump? Number 3, report any fluid drainage issues and describe whether it is pus, fecal matter, or blood. Number 4, describe any additional symptoms such as fever or chills. And number 5, be persistent in being seen right away, especially if there is a possibility of infection, to avoid sepsis. While there are no quick fixes when it comes to inflammatory bowel disease or fistula, we hope this audio guide helps you feel more comfortable with sharing your symptoms with your healthcare provider. Thank you for listening today to our audio guide on fistulas and Crohn's disease. I'm Corey Greenblatt, Associate Director of Policy and Advocacy for the Global Healthy Living Foundation. For more information about managing Crohn's disease and fistula, please visit ghlf.org/fistula-support.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.